Hi. Hi. Are you able to hear me?
Yeah, I'm hearing you. Am I audible?
Yes. Now you're audible. I was not able to hear you till now.
Acha, okay.
Yeah.
So, welcoming you all there to this session with Dr. Tejal Kothari, consultant psychiatrist, Delhi. Uh, and not the best of the times, but very thankfully, we are all connected in these trying times. So that's a big respite. Lockdown is on, and more than that, that's the second wave, deadly wave is kind of proved to be really scary. Um, so hi, and also we have viewers with us also. In case there are relevant questions, please do post. So Tejal, how are you? And I would just like to ask you, you have recently recovered from the infection itself. So how what do you want to say? Yeah.
I'm perfect. Lucky. I was lucky. The infection was not very serious. It was very mild. So I think I was quite lucky
Okay.
compared to a lot of other people, unfortunately. And
Hmm.
I think I'm absolutely fine now. Just slight weakness post COVID, but otherwise I'm absolutely fine. I think I've been quite
Okay.
lucky because a lot of people have lost their lives, and this has been a very trying and a terrible time for a lot of people. So
Extremely.
yeah,
Yes. Okay.
absolutely.
Okay, when we talk of COVID, the pandemic, especially after this onslaught of the second wave, the fear and panic is enormous. I mean, it's kind of ruling everybody's mind, life as of now. Anyways, no, we can't go out, and you are inbound indoors, but the fear is kind of taking a toll on everyone's mind. So what do you suggest, Tejal, on this?
See, the thing is, ek to fear is because of what we are suffering from. Of course, whoever has gone through COVID, whoever has gone through this entire, this entire ordeal, whoever has gone through that, the fear is very legitimate because there are people who did not find beds, there are people who did not find oxygen. So for them, yes, the fear is very legitimate. But a lot of part of this fear has been created by the media. It has been created by all these pictures being circulated. It has been created by listening constantly to stories all day कि अभी इसके पास oxygen नहीं था तो हमें क्या हो जाएगा. A lot of misinformation was spread during this time. So I feel that rather than just concentrating on ourselves, I think we are more scared because of a lot of misinformation, a lot of misinterpretation of facts. For example, a lot of people started storing drugs. A lot of people started storing oxygen cylinders कि अगर हमें हो गया तो क्या होगा, without understanding how to actually apply oxygen, how to actually take these medications. Okay, so a lot of this fear has been
Mm-hmm.
created in the
Yes.
right. So first and foremost,
Mm.
get the correct information about COVID. It does not have to be from your news channels. It does not have to be from your WhatsApp forwards. It has to be from proper legitimate WHO websites. They're all, see, in today's time with internet and everything, all the information is
Yeah.
available. See, whatever you want, all
Right.
kinds of information is available, right? So get your
Mm-hmm.
information from right sources. Get your information from websites that are authentic. For example, you have your WHO website, you have Indian government's website that gives you correct information regarding COVID. Okay, so get your information correct. So that will help you exactly know, help you stop this fear that अगर मुझे हो गया तो मैं क्या करूंगा, ये भी तो कोविड नहीं है, वो तो कोविड नहीं है, हर सिम्टम कोविड नहीं है. Okay, not every, sometimes खांसी जुकाम is not COVID. You may not have COVID, you may be asthmatic, you may have a past history of something else, you may be just having allergic rhinitis, which is very common in this kind of time, right? So it's very important
Yeah.
to get the right perception and the right knowledge regarding COVID, okay,
Yes.
which is not available. It is not through Instagram, it is not through WhatsApp, it is through legitimate websites. So I think that is one.
Absolutely.
And secondly, we have
Yeah.
to understand that this is a pandemic, right? Everyone is suffering. You are not alone in this. I know it's not easy when you've gone through something yourself. It's not easy to say कि यार ये what am I with that, this fear it's a legitimate kind of a fear, but you have to understand that the entire world is suffering. You are not the only person suffering here, right? So it's a pandemic. So there is going to be, you may be suffering from, you may get COVID tomorrow, you may have certain symptoms, but again, be very careful to talk to a doctor directly. Do not start
Right.
check out these, do not buy things without any ayurvedic dawaiyan. See, I mean, there is no I'm not against Ayurveda. I'm not against any of this, but there has to be some kind of evidence for it, right? So ऐसे कोई evidence नहीं है, कुछ नहीं है, and you're just going on buying things, and you're constantly drinking hot water throughout the day and making kadas. That can help your immunity in general. That's not a bad thing to do, but that's not going to really help you against COVID, right? So get the right information. Do not spread misinformation. Stop sending those WhatsApp messages to everyone. Stop, reading this kind of stuff on, on WhatsApp and forwarding them. Stop spreading panic also. Stop spreading panic and stop spreading panic. Okay?
Yeah. I think you just said it, and that's what I wanted to ask you. Okay, fine, there are guidelines, but what's happening? I will just say, take my own case as in क्या करना है, किस टाइम पे करना है. Guidelines are coming, but they might not be timely. So yes, there is a lot of information floating all around, and we have to be very careful to pick and choose what to actually consume. But kahan pe, Tejal, what's the problem going on? Why there is so much of chaos? Keep I'll give you my example. I just received this guideline say about 2-3 days back कि you have to keep the house ventilated. But before that, say about 20 days back, myself only, I was asking every doctor friend of mine कि क्या करूं मैं, अपने घर की खिड़कियां खुली रखूं. There were so many cases all around you. I think you understand that what happens to you. I mean कि there are patients all around. क्या करें, बंद करें, खुला रखें, these kind of things which we all face.
Right. So that's what actually see, medical guidelines are constantly changing. Okay, we need to change as soon as we get new information. Medical guidelines change. So आज remdesivir they might have said that remdesivir is important. After some time, you might even hear that remdesivir is not as important, right? So that's how medical science is. It is changing because the more evidence you keep getting, the more changes they are made. So my suggestion for all is stick to talking to your family doctor if you have any. If you have a family doctor, you have a doctor that you're very comfortable with, ask them the questions. They'll be more than willing to answer. And just in case you don't really have a doctor with, like I told you, WHO has its guidelines and Indian government also has its guidelines given on its website. So you can stick to that. Okay. Now, जैसे अभी आपने बोला कि ventilation की बात थी. See, earlier we were not so sure whether COVID was through aerosol. Now it's become sure that second wave it's spreading through aerosols. So rather than keeping your you keep your room एकदम बंद रखोगे, AC के through, if AC के through the same air keeps on circulating. So they say कि in these offices and all, the reason you had all these COVID is because AC था, there was no opening, so this same air was circulating. So one person has COVID, everybody else was getting it. So that everybody gets it, right? Yeah. The new thing is that you need to open your windows, you need to keep the sunlight in, you need to keep them ventilated. So things are changed, things keep changing, guidelines will keep changing as per the new evidence that we keep getting.
Okay. All right. Okay. Very unfortunately, the death rate, I mean, we all have seen my family, known ones, acquaintances, friends, and, there are many who are grieving at the moment. And for many, there have been no closures because of the COVID protocol. So what you have to tell them?
It's extremely unfortunate for anybody who has lost their family members. Somebody has lost them after, like, say 20-25 days of admission in hospital. Somebody has lost them before because they could not take them to the hospital. So this entire I think it's a very, very difficult ordeal, because a lot of people that I've treated in my OPD also, and a lot of people who have come to me also, they always say that we have this sense of guilt. We could have done something else, we could have tried to do something else, and that sense of guilt is really killing. So ये जो grief period होता है, this grief period, our suggestion as psychiatrists is always that let this grief period pass. Okay, take your time. Up this time you will be grieving. Do not expect yourself to suddenly become all right. Okay, grieve as much as you can, cry as much as you can, seek help of people around you, try and be with your family as much as possible during this time, right? And I know it's very easy to say from my side, so it's not really fair for me to use these words, but the truth is that let's just celebrate the life that they lived. Let us celebrate the time they had with you. Let's remember the happier thoughts. Although it's again, like I said, like, that's very, very difficult for anybody going through this. I will not say कि अब आप ठीक हो जाओ, कोई बात नहीं हो सकता. At least I expect that grieving period to be, unfortunately, that grieving period is usually from 2 to 6 months. Okay, beyond 6 months, there's a high risk of developing depression in them. So if you're going through this grieving process and it is increasing day by day rather than reducing, if you're having this these guilty spells and these crying moods, and if this grief is continuing beyond 6 months, you may even be suffering from depression. So my suggestion would be, look for a counselor, look for a psychologist, look for a psychiatrist around you. A psychologist can help you with counseling. Grief counseling is something that's commonly done by psychologists. So if you have a counselor or a psychologist around you, even earlier, I'm not saying 6 months is not a time period. Nahi hai. If you're feeling suicidal, if you're feeling very low, if you're feeling ki nahi yaar, I need to go and join them, and you're getting thoughts like that, go to a mental health professional. You go to a psychiatrist, go to a psychologist. If you're getting these kind of feelings, you may need grief counseling, you may need therapy. However, if aisa nahi hai, if it's the sense of emotion, that loss, that you're feeling, then please try to understand that this is a normal process. First you're going to deny it, first you're going to feel very irritable, you're going to feel very guilty of what I did. Eventually you'll accept it. So the acceptance will come, but it will take time. Right? You have to accept one thing, that you did everything possible, right? Okay? Even if you were not able to take them all the way to the hospital, even if you were not able to get an oxygen cylinder, you as being with them, you try to do whatever possible. I'm sure जिसने भी कोशिश की, जैसे भी कोशिश की, some of the sons I know were far away from their parents. Some of them were in US, UK. They could not contact their parents, and it was very difficult for everybody. So it's not your fault. That's the first most important thing to realize. It was not your fault. This pandemic has been it's so unique, and it is so new. The entire world has not faced something like this. So it's unfair to blame yourself. It is unfair to feel कि यार मैं कुछ कर पाती, या मैं कुछ नहीं कर पाते, आप चाह के भी नहीं कर पाते. Right? And no amount of medication, no people, because since I worked in COVID myself, I worked in COVID duties a lot. So, gone through COVID duties, and we've seen COVID patients. I can clearly tell you that there are patients in which we have tried everything, starting from plasma to steroids to everything, but nothing has happened. We were not able to save them. A lot of doctors were not able to save them. Right? So this is, and I got this input from my friends working in medicine, anesthesia, ICU, that the patients that we have tried a lot to save, we were not able to save a lot of them. Right? So please try to understand that this is not your fault. You have to go through the grieving process. Try to be a family. Try to be together. Try to remember them in the best possible way and in the happiest possible way that you can. And remember that this too shall pass. Because unfortunately, whatever it is, time is a great healer as much as possible. And again, I know a lot of people who have lost someone would be saying कि आपको क्या पता है, and I agree with that. मुझे सच में नहीं पता है, because that's what I have not lost anyone during this time, but whoever has, I know, has gone through waves of depression. So if you're feeling really sad, and if you're feeling that ये मैं control ही नहीं कर पा रही हूँ, please meet a mental health professional.
You mentioned that immunity booster things, काढ़ा, generally जब से ये pandemic start हुआ है, काढ़ा and all these things, yes, they have their own benefits, but if you can throw some light on actually मतलब immunity की जो बात हो रही है, and actual scenario क्या है, can we really boost up our immunity with all these things, या हमको करना क्या चाहिए?
See, the thing is, actual immunity boost आप vaccination से ही कर सकते हो. If you have got vaccine against COVID, you have enough immunity to survive COVID. Right? That's been proven. That's the most important thing. So get vaccinated. That's the first thing. It's very important to get your vaccination in time and get vaccinated as early as possible. And जितनी जल्दी आप vaccine लगवा सकते हो, आप लगवा लो. That is most important. Secondly, see, we know that vitamin C, zinc levels, vitamin C, vitamin D, or protein. In fact, there's just mentioned whey protein. So whey proteins, all these things, they help in increasing your immunity. They genuinely help. They make you stronger from inside. They'll make you immune to a lot of other things as well, not just COVID. So all this is helping you increase a general immunity. Right? This has nothing to do with specifically against COVID, but yes, if you have good amount of vitamin C, you have good amount of, you have a lot of other these things. This is going to help you. Overall, they're going to help you in COVID. So when you have your kadha, जिसमें आप थोड़ा सा नींबू डाल लेते हो, that is basically increasing vitamin C, right? If you're going outside getting sunlight, you're helping with vitamin D. So a lot of these kadhas and all your traditional medicines, they're just helping you with basic वो आपको वही vitamin C, vitamin D दे रहे हैं, थोड़ी सी immunity बढ़ा रहे हैं. But actual immunity का बढ़ाने के लिए you need to get your vaccination done. Do not depend on
Yes.
cordials and kahadas and all. They are not really going to help you out. What is going to genuinely help you is your vaccination. If you can get that done, you will be genuinely be immune against COVID. Otherwise, all these strategies are good for healthy living. For in general, it's good to drink hot water.
In general also, but not to overdo them for sure.
Not at all.
Because
Not at all. You're going to burn your throat. There is no point कि सुबह से शाम तक मैं गर्म पानी पी रही हूँ and then I can go out. ऐसा कुछ भी नहीं है. Nonsense है. Just use your mask, do your usual social distancing, and and get vaccinated. Have your vitamin C in any form. आमला ले सकते हो. सब कुछ ले सकते हो. तो वो सब कर सकते हो. करो, बहुत अच्छी बात है. It's always good to be be educated about these things. It's good to follow traditional medicine and a lot of things. But it's not going to ensure immunity against COVID. ऐसा नहीं है कि इसकी वजह से COVID नहीं होगा आपको.
Okay, all right. Okay. Also, कुछ लोगों ने ये जो that you mentioned, zinc हो गया, vitamin C हो गया, मतलब ये वैसे ही लेना over the counter drugs है, because ये लेना शुरू कर दिया है. So
right. That's a good thing. That's a good thing in general. अच्छी बात है. आप ले लो vitamins. Vitamin C is a water soluble vitamin. आप जितना भी लोगे over नहीं होगा vitamin. Like vitamin C is one vitamin which is not going to go overboard. Even if you like, for example, if you take vitamin D beyond 4 to 6 months, you might end up having hypervitaminosis, excessive vitamin D accumulation, which is also bad because it's a fat soluble vitamin. But water soluble vitamin like vitamin B and C, you can just take them at any point that you want to. And it's not going to be, there's going to be no
harm actually.
Yeah, there's no harm actually. So please continue.
Okay. ये सब चल रहा है and lockdown है. As a result, nobody is actually going out apart from the essential services people. Emotionally, it's proving to be difficult. And this is the second wave. बहुत uncertainty है कि आगे क्या होगा, because we are listening about third wave. मतलब क्या होना है आगे, कुछ पता नहीं है. So how to handle?
See, nobody knows आगे क्या होगा. Like last year in 2020 March, when I think lockdown was announced, we thought ये 1 महीने का होगा या 2 महीने का होगा, and it ended up almost for 6 months, and then unlocking started, and then again, and now again we are going through lockdown. So it's a very, very uncertain period. Okay, it's very important to realize it's a very uncertain period. ठीक है, we don't. Even as doctors, we don't really have an answer कि ये कब तक खत्म होगा, ये 2025 तक चलेगा, ये 2020 तक चलेगा. We don't know. What we can expect is with vaccination, there's going to be herd immunity, and we will all hopefully be able to, open our stores and open our country, and we should be able to, work as normally as possible. But again, this is a very unprecedented kind of a thing. This has never happened in years now. I think last we remember was 1911 when Spanish flu had happened. Uske baad, I don't think this kind of an epidemic, such proportions has never happened. Exactly. Yes. So first and foremost, you have to understand. I think you have to really understand that the fact that you're alive and that you have a family, that you have a roof on your head is one of the biggest blessings during this pandemic. I'm not saying this in any wrong way, but I'm just mean it that seriously at this point of time, people are suffering way too much, So you need to count your blessings here. You just cannot get over. It might sound very cliched, but you need to count your blessings at this point. If you have a salary coming, if you have a breadwinner in your house, if you're eating properly, if you're able to sleep, and you've not lost somebody to COVID, I think you're really blessed. There's someone up there taking care of you, because I've really seen families getting devastated by COVID. So that is one most important thing. Secondly, if you're working from home, for example, a lot of our corporates and a lot of people are working from home. So you have to understand that you have to really keep a calendar in front of you so that you have a sense of time. Often हम लोग घर में काम करते करते sense of time नहीं रहती, day नहीं रहता, याद नहीं रहता Thursday की Friday है, क्या है. So, keep a calendar there in front of you. Make sure you get up at one particular time in the morning. If it's 8 o'clock, then make sure you get up at 8 o'clock daily. Do not stretch रात को 12 बजे 2 बजे तक Netflix देख लिया 3. No, it's going to harm your mental health. So sleep at time, get up at time. Have that schedule that you were having earlier also. Especially for corporate people, I'm saying, because they tend to overdo their work. They tend to sit with their emails long because they're now working from home. So chalo thoda extra kar lete hain. Don't do that. Jitna kaam kar rahe the utna karo. Stick to your work. Nobody can say anything to you right now. You're going through a very bad time. So keep that time properly. 8 baje subah utھ rahe ho to 8 baje utho. Make sure that you have a routine in check. My suggestion is always, wear new clothes, get dressed, wear good clothes, put on your makeup if you're a female, and wear your shoes. when you wear your shoes at home, you get this sense कि मुझे कहीं जाना है, I'm doing something, that will really help. You will avoid the bed also, and you'll be kind of you'll kind of always feel कि यार I'm doing something. So always wear your shoes or slip. Don't wear your chappals. Don't be in pajamas. Don't just sit with a nice t-shirt and pajama niche. It's not good for you. Okay. Office वालों को कुछ नहीं पता चलेगा, आपके लिए अच्छा नहीं है. So maintain a proper routine. Get up, take a proper bath. Look good, look your best, get your shoes on, start working on time, take a break whenever you want, take a break the way you used to take in office, call up your friends, maybe you guys can have a conference call of that chai sutta that you have at office. You can take those 10-15 minutes off together. So try to simulate that environment, because that way you will feel that you're not alone. So the biggest problem is that unmarried people, single people who are just alone in a single room, I think they face a lot of loneliness during this time. So you have to understand that you're not alone, because a lot of other people are facing the same situation. So connect with your friends on Skype, maybe connect with your friends on phone calls during that time. Sit and chat with them, have a short chat, gossip, talk, whatever you do. Just try to simulate that environment in office. Okay, and do not get stuck into this rut of not wearing decent clothes. But उठ के आ गए, t-shirt पहन रहे हैं, मुंह नहीं धोया, ये सब मत करो. टाइम पे जैसे ऑफिस जाते थे वैसा करो. This time is going to end sometime. It's not going to be forever. Hopefully this time during the second wave we are expecting that June end tak probably this the second wave in Delhi mein to already cases have really come down, and I think other areas are also now managing. So June end tak we should probably be seeing an unlock in July some. So that's what.
Okay.
Yeah, try to stick to that. Okay, and understand again that this is a blessing that you're able to sit at home and work, you're getting money, so that's very, very important. But beyond this, if you're feeling very low, if you're feeling very lonely, if you feel like crying, if you think you're depressed, you're starting to get depressive symptoms, then please go and visit a mental health professional.
Yeah, right. Another thing is, as we are talking about waves, this thing just came to me that yes, we are all indoors, and अभी हम लोगों ने अपने को बहुत बंद कर रखा है everything. But जैसे ही unlock start होता है, and as you suggested, कि we are living right now, we live a very different lifestyle. It's kind of mentally proven to be taxing for everybody. So जैसे ही unlock होता है ना, वो एक general जो trend दिखाई देता है कि निकलो.
Everybody wants to get out.
Yeah. So उसमें फिर मतलब social distancing हो गया. I'm sure mentally all of us are getting so much. We have so much up our sleeves कि उस time फिर social distancing हो गया या COVID का fear हो गया. Everything takes a backseat. The only idea in mind is to just get out and enjoy life.
Absolutely. So I think that's where we've gone wrong in general. That's why probably the second wave was much worse than first. That when the unlock happened, we totally forgot that COVID existed, and we all continued to party and we all went out. So that's where we went wrong. And I'm really hoping that this time people would be more sensitive to the fact that a lot of them have lost lives and a lot of them have struggled so much. So I think this sensitivity we should continue this sensitivity. We should continue this fact that people are suffering and there is. Unlock ho gaya, very good, but I think you can avoid that faltu trip to mall that you don't want to do. Still be very careful. At least till end of 2021, till we are completely vaccinated, I would suggest everyone to take their respective precautions, because that is the only way we can actually avoid getting COVID. Otherwise, there is no other way. We cannot keep blaming the government. I agree, government is goofed up at many levels, but we cannot keep blaming the government, because by the end of it, when we lose someone in our family, it is going to be just for us. It is not going to be for Modi or Kejriwal. So it doesn't matter to them really. For it's just a number. It is statistics till you lose somebody in your own house. You can say that there's 10% death rate, but for the people who have lost their own someone, it's not a death rate. It's not a number, right? So please be careful. After, like you said very correctly, let's not rush to the malls. Let's not rush for that trip. Let's not rush to get married. Let's give it all a time. Let's behave sensibly. And let's understand that we don't want a third wave to come, right? We try and avoid the third wave as much as possible. And I think it's up to each and every one of us. It's not just
each one of us.
Yeah, each and every one.
Yes. Yeah, exactly. And somewhere, somehow, we have to be responsible for our own behavior as well.
Exactly.
एक और Yeah, a doctor friend of mine messaged me in the morning when he heard that I'm having this conversation with you, and he's a pediatric himself. But then he said, "Ki main, I should ask you." He has a daughter who's in class 12, and but he was like, "Ki irritability क्वेश्चन बहुत बढ़ गया है." She's a grown up girl, but because she's at this crucial juncture jahan pe they are completely homebound, but career ka bahut important ek phase hai. I'm sure all of them 11th 12th 10th ke bache, they're facing a lot of uncertainty ki
Absolutely,
bhai kya
absolutely.
hone wala hai, kaise hone wala hai. As well as the smaller kids also now, who are full of energy and activity. They are also like my own daughter, 6-year old. Her
Yeah.
lifestyle, very active kid, but her lifestyle has completely changed now. And I'm really concerned कि भाई for a longer time she's been sitting, whatever she is doing, but not going to park. So ये हो रहा है. So what do you have to say on that?
See, it's very easy for adults to understand, because we know what is going through. For kids, it's very difficult, and I think for even more difficult for parents of younger kids, elder बच्चे फिर भी 11th 12th के बच्चों को शायद फिर भी थोड़ा समझाया जा सकता है, but for young children, very small kids, it's very difficult, And everybody, I know 11th 12th students of 12th especially, because they have to answer their boards. They're very excited. They're very excited to join college, and now everything is stopped. In fact, second year, third years in college, who have festivals and all these things is done in that second third year, they are missing out on it. So I
Yeah,
think students
yeah.
and youngsters are probably missing out on a lot of experience that they were supposed to get during this time, and it's quite unfortunate. So I'll start with the youngest of kids. Suppose you have like a 4-year, like you said, you have a 6-year-old and all. You have to engage her as much as possible inside the house. I know it's very difficult for parents, and again, it's very easy because I'm not a mother. So it's very easy for me to say this, and I know it's very difficult because a lot of my friends, they just tell me कि हाँ बोलना बहुत आसान होता है, engage करो. 6 साल के बच्चों को engage करना is very tough. So the thing is, you need to, again, like I said, you need to have some kind of a routine for them. Maybe something that resembles the school, something that resembles some time, that they spend outside in their school time. So whatever space you have, if you can, probably you can spend some time. You obviously will be spending a lot more time with them than you used to. So if you could have some board games or some small games that they're interested in, it's screen the whole day is not a good idea. They're watching screen the whole day. That's not a great idea. आपको बेसिकली बच्चों को थकाना बहुत जरूरी है, because once they are tired, that's the only time they'll actually sleep and let you sleep. So make sure that you have enough, you spend a lot of time with them, you make sure that they're tired in the day, you give them number of activities, and give them, like, just basically you'll have to engage them somehow, the youngsters. Okay. And if possible, if you have certain areas at home जिनमें थोड़ा सा, for example, suppose you have 2 bedrooms and one of them is slightly empty. I'm talking about people who have a little bit of money and a little bit of resources. You empty one of the rooms just for the kids, empty that one room, let them run helter-skelter in the room, let them go do whatever they want, let them paint in the room, let them sing, let them do whatever they feel like, let it be their safe haven, let them feel that I'm doing something, that this is my area, let them get that feel so that they don't get frustrated. Okay. And and you can, again, like for adults, you can make them talk to their friends on phone, you can make them talk to their friends face to face, so that at least they feel the sense that everybody is around. Try and explain to them what is happening in very simple words, try and tell them in extremely simple words what is happening. And kids are very perceptive. Kids are going to understand things. ऐसा नहीं है कि बच्चों को समझ नहीं आता. They understand things very well and they pick up things from adults very quickly, so be careful especially be careful of your language, the way you talk around each other inside the house, because now they're going to be there for a very long time, right? So you need to be very careful of the way you communicate with your husband or you communicate with others on phone, because that's when they're going to pick up a lot of things now new at home, so there should be slightly, so thoda sa wahan pe there has to be a discretion from the adults, Now coming to youngsters, like teenagers especially, because it's so difficult for them to be at home again, but teenagers again are probably more easier for you to explain to them what is happening, right? So explain to them the proper situation, tell them exactly what is happening. Don't don't disregard their feelings, don't disregard the fact अरे तुम्हें तो पता है, तुम 17 साल के, तुम्हें ये नहीं पता क्या हो रहा है, बाहर जाने की जरूरत नहीं है. Don't talk to them like that, don't pull them down. You have a proper conversation. them that, see, this is beta, this is what is happening. This is the problem if you go out. This is the problem why we need to do social distancing. And we understand, we are with you at every step. So then for them, especially, I would say make sure they have a timetable. For teenagers, especially, because nowadays at night, they'll just pick up the mobile and they'll be on phone for like the entire night, and they'll be chatting or they'll be on Facebooks. And that's very, very unhealthy for them, extremely unhealthy. So make sure that you have some kind of routine, some kind of, some kind of activity schedule for them. Ki bhai subah se shaam tak aise aise karoge. So that's extremely important for teenagers. And no, a lot of them are developing irritability. A lot of them may get into depression at this point of time, unfortunately, because they're really losing out. But again, like I said earlier also, you have to understand this is happening to each and every one of us. There is no way currently for any of us to get out of the situation without everybody else getting improving. So it's a pandemic. It's where everybody else is equally important. It's not just a illness that you are suffering from. It's not just you. It's everybody. Okay. So the teenagers need to understand that this has never happened. It has never ever happened. So all the class 12 students who are really irritated with the government and really irritated with their parents, please understand that your parents have not faced this ever. The Indian government has not faced this ever. We really don't know what to do. So it's not just them. It is not just them. So try to understand your parents as people, right? And parents should also avoid getting irritable with them, should avoid regular fights, should avoid, treating them as kids. When they're 16, 17, be their friends, don't treat them like children. If you tell them, ki, bhai, tumhe to kuch pata nahi, ab chupchap baith jao andar, it's not going to work right now. They're just going to get more and more irritable. So try and communicate with them first and foremost. Have a schedule. Make sure that they can see social media, they can be on Facebook, but there has to be a particular time for it, particular amount for it. Or there are a lot of things at home you can do, kids, especially nowadays, and especially because we are so lucky that internet is there. A lot of people who have access to internet, you can learn new hobbies, you can do things that you've not done before. You can learn cooking, you can learn your guitar, you can learn your singing. There's so many things. If you have that kind of a again, I'm saying, if you have that kind of a connection at home, or if you have that kind of internet at home, please go ahead and learn new things. Let's try and get. But don't be too worried about productivity. Okay, don't say कि मेरे friend ने इतना कर लिया मैं तो नहीं कर पाया. कोई बात नहीं यार. You have to survive the pandemic. That is the basic aim. Okay, you just have to go through this and survive this.
Yeah, absolutely. I think we have to be accepting of the fact that it's a changed life and lifestyle for each one of us.
Exactly.
Which is physically as well as mentally taking care of ourselves is also extremely important. Now when you maybe this is the last question and topic that we touch upon, but I think this is also important as far as जो families आज के date में कर रहे हैं experience. You said कि kids के सामने we set an example. The older kids can understand, but still we have to be mindful of how the parents are behaving. But at the same time, because of this uncertain situation, there are families who are suffering because of job losses, maybe drop in businesses and financial crunches. So as a result, that aspect is also not easy to handle. That stress is also coming on. So how do you guide in that?
See, like I said, the families who are really suffering, it's a very tough time for them, right? It is. I cannot say that do this and do that and become okay, because somebody who's lost their job has to start looking for a new job right now, and they may be the breadwinners in the family. There may be a major lot of good businesses I know have shut down, especially restaurant owners, pub owners. These are businesses that have literally been shut down. Like Gurleen has recently added, even seafarers are suffering. Sometimes all the people in merchant navy, sometimes the crew change is suspended. You've been off work for like now 8 months, 9 months. The money is not coming. A lot of actors are suffering. So a lot of groups are suffering. So there are different professions that are genuinely, they really are suffering through this. So during again, like I said, Ekta, during this time we have to be extremely patient. See, you've lost your job, that is one thing. But if you're going to make it worse by being bad to your family, by being mean to your family, by screaming and shouting at them, getting irritable, you're going to get nothing. You're just going to get fractured family dynamics, nothing else. Okay, so during this point of time, if you're going through a major loss of any financial loss or anything, this point, you have to understand, A, everybody is going through it. I know that is not something that gives you any kind of solace, but understand that a huge lot of people are going through it, first thing. And secondly,
Yeah.
this is going to end. It's not a remember one thing, it is not something forever that's going to last forever. This is a pandemic, it is going to end. Things are going to get better. So patience is extremely, extremely important at this point of time. Okay, you have to be very patient. And thirdly, if you're not going to be irritable, if you're going to be happy, if you're going to look, try and do things better, your mindset will be better to to go through something like this. You need to have a better mindset, in fact, to go through something like this, because it's a
Yeah,
very, very
right.
difficult situation for anyone. So मैं ये नहीं कह सकती हूँ कि जिनकी नौकरी छूट गई है कोई बात नहीं यार ठीक हो जाएगा. I will not say that. That's really wrong. But yes, this is the time when you need to show your patience. This is the time when you need to show courage. And if you can get through this, and you can get through one of these times in life, I think you can get through anything. So I think you're extremely brave to be going through all of this. And again, during this time, if you start feeling कि नहीं यार ये नहीं ठीक होने वाला, hopelessness, helplessness, if you start feeling guilty, you start feeling I shouldn't have done this, start getting suicidal ideas, then please go to a mental health professional, visit a psychiatrist near you. They'll be able to help you better, because you may be developing depression.
Yeah.
Maybe
Yes.
at this point in time, so just have as much patience as possible. Try to have a mindset that's going to help you and not be not to get behind in life. Try to have a mindset, try to do as much as possible as you can. Okay, but it's a tough time.
Yes, and this is not the time. Yes, you should be talking a lot to friends and everything. Keep yourself as light and fun, and everything is fine. But if there is an emotional issue or mental thing, I think this is the time not to hesitate at all in consulting a mental health professional.
Absolutely. It's very important, because a lot of people are developing depression and anxiety during this time, and they all feel कि क्या जरूरत है जाने की, ठीक हो जाएगा. ऐसा नहीं होगा. A lot of you are vulnerable to mental illnesses. You may be developing mental illnesses. So be very sure that if whatever is happening, just go and meet a mental health professional.
Yeah, right. Just coming back to COVID, and uske baad hum close karte. I hope, Tejal, I'm not, because you also have recovered. I hope I'm not tiring you, and you're fine.
Not at all. Absolutely. Tell me.
अच्छा, थोड़ा सा ये भी देखा गया है कि yes, now तो everyone is so much aware and everything, but still a few people are not being responsible enough. मतलब अभी भी मास्क नहीं पहना जा रहा है. Even COVID patients are showing such kind of behavior in general in society कि अरे हमें तो हो गया है COVID, अब क्या these kind of things are happening. क्या मास्क पहनना, as a result fear factor और बहुत बढ़ जाता है, या you just don't know how to safeguard yourself. ये क्या है? So what do you say?
See, the thing is that, you have to each, right now it's like a war, each for themselves. Okay, so अपने लिए सबको अपने लिए जीना है, अपने को help, you make sure you are not a COVID idiot. Let the other be, but make sure that you are not an idiot. Okay, so for your own sake, wear a mask. Like I think Varshne is asked whether you need to wear a mask at home. You don't need to wear a mask at home unless and until you have a COVID patient at home. If you have a COVID patient, then you can wear a mask. Otherwise, it's not really needed to. You don't really need to wear a mask at home. But
I'm sorry, I'm interrupting you, but वो neighborhood में जैसे बिल्कुल साथ में हो रहा है, even I have faced it.
That case you can, but घर के अंदर as such you're very far removed from the other house. You really don't need to. There is really no need to wear a mask. But yes, if you go out, you step out and you step amongst people, you need to wear a mask. Then that is essential. So you have to be basically. It's like a war, like I said. It's a war. Basically, it's each one for themselves. So you need to be careful that you are wearing a mask. You need to be careful that you have your sanitizer. You need to be careful that you are socially distant from people. So it's very important that you keep that precautions for yourself. For rest of them, you can't do anything about it. You can't stop people. You can't fight with them. You cannot get into arguments with people. कोई फायदा नहीं होने वाला उसका. They'll give you all kinds of explanations. So don't do that. Be careful. अपना ध्यान खुद रखो. बहुत जरूरी है. Make sure you wear your mask. Make sure you take social distancing seriously. Make sure you take your precautions properly. That is most important. Let the world do what they want to do. किसी दूसरे को COVID है, but you're wearing a double mask, it is not going to affect you. Okay, you will be very much saved. मतलब 80 to 90% आपका risk कम हो जाता है, So wearing a mask is extremely important. So you do your work, forget about the rest. You cannot control the world, unfortunately.
Yeah.
There are a lot of
Yeah.
idiots around, but you can't do much about it. But you take care of yourself. That's very important.
Okay. Okay. Okay, I think it was such an informative session, Tejal. Thank you for taking out time. I know you have just recovered,
No, no,
but
no. I really wanted to for a long time, I told you, but unfortunately we could not set a time and date. But luckily, I think we did
yeah,
it this time. So it was great being a part of this. Thank you so much. And I think we'll have more collaborations later on. And you take care
oh,
of yourself and take care of your family as well.
of course. Just one tip or one line that you want to maybe keep is time how to keep oneself emotionally sound and emotionally well-being के लिए क्या
Right.
करना है?
See, for your emotional well-being, basically at this point of time, I'm not talking about people who are suffering from mental illness. I'm not talking about depression. I'm not talking about anxiety. I'm just talking about general mental health. So keep your general mental health okay during this time. Try and focus on the good parts of life. Try and focus on the good things that you've achieved. Try and focus on your hobbies. Try and focus have some kind of a goal in your daytime. That I'm going to do this. I'm going to achieve this. If there's that exam you want to crack, try and study a little extra for it. Keep that aim in mind. Keep that particular goal in mind. And remember, this too shall pass. This is not the end of the world. We are going to get through this. We have gotten through a lot of it. Yes, like Aarti suggested, meditation is a very good thing. If you can do meditation, nothing like it. A lot of people can't, but if you can do meditation,
Yes.
focus, meditation, stay in time, sleep in time, and get up in time. That's very important. Do not mess up your sleep cycles. That is the worst. So avoid messing up your sleep cycle. Meditate properly. Have good food. Eat good food. Exercise a little bit. The basics work. So basics are very important at this point of time. The basics work just the way they work always. So keep those basics right. Have a hobby, have a short-term goal that you want to do. Yes, you can do cardio inside the house. You can do whatever makes you feel good. Yoga, breathing exercise, everybody's suggesting. Absolutely. Do whatever it takes to make you happy. Have that one goal, have that one hobby that you're happy. Try and keep a good home. Try and keep a clean house. I'm not saying this just for this, but keep an organized house. You'll feel good when you come in. You feel good when you have a nicely made bed rather ki ganda sa bed hai aur kitabein padhi hain. Try to keep safe, try to keep clean. Okay. And so that is very important.
Yeah, I would also like to share one thing how we have survived this 1 year. We are a bunch of friends, and what we do is we keep constantly in touch through Zoom meets every week, and we also keep on doing dress up and performing for each other's birthdays, anniversaries. So that has really helped all of us during this time. And thank you once again, Tejal. Here's my daughter saying a big thank you to you. Okay. You take care of yourself, and yeah, thanks again from all of us for giving us so valuable information. I think which we needed.
Thank you.
At this point of time.
Thank you so
all
much.
right.
Thank you for having me. Thank you so much.
Take care. Thank you, all the viewers. Yeah. Take care of yourself. Yeah. Okay. So thank you everybody for joining us for this live session with Dr. Tejal Kothari. And please take very good care of yourself physically as well as mentally also, because that is also equally important at this time.